Hi, welcome to Nursingmanthra English question practice. Today we are going to discuss gastrointestinal system. Hypertrophic pyloric stenosis related question we will discuss. The parent of a 21-day-old male infant reports that the infant is throwing up a lot. Which assessment should the nurse makes to help determine if pyloric stenosis is an issue? Select all that apply. SATA question. Assess the parent's feeding technique. Option B. Check for family history of gluten enteropathy. Option C. Check for history of physiological hyperbilirubinemia. Option 4. Check if the vomiting is projectile. Option E. Compare current weight to birth weight. These are the options given for this question. We have to select multiple response items. The answers are option A. Assess the parent's feeding technique. And option D. Check if the vomiting is projectile. And option E. Compare current weight to the birth weight. So, whenever you are checking for pyloric stenosis, you have to see what is pyloric stenosis. In the stomach, the structure pylorus is there. So, you can see in this picture. In pyloric stenosis, there will be hypertrophy of the pylorus will be there. Gradual hypertrophy of the pylorus until the symptom onset at age 3 to 5 weeks. It is common in firstborn boys and the etiology is unclear. Pyloric stenosis that present with a postprandial projectile vomiting. Projectile vomiting in the sense that is vomiting ejected up to the 3 feet, followed by hunger, that is a hungry vomiter like that we can call. This is clearly distinguished from the wet verbs. Infants have due to a weak lower esophageal sphincter, wet verbs are getting, that is differ from this projectile vomiting. The emesis is non-bilous as the obstruction is proximal to the bile duct. That's why bile content will not be there, non-bilous. Infants have a poor weight gain and are often dehydrated. What is the symptoms of dehydration? Sunken fontanelle, decreased skin turgor, delayed capillary refill, all these will be there. The amount of milk consumed, particularly with the bottle feeding, along with the mother's technique, like how the mother is doing the adequate burping is giving or not after the feeding, that all should be assessed to ensure there is no excessive air swallowing or overfeeding. That all is an etiology for this. So, these all things are there or not also we have to assess. In option 2, like at times formula intolerance or allergy is suspected initially when the infant first starts vomiting. But however, the gluten celiac disease or gluten enteropathy is related to intolerance to gluten. Gluten that is a protein which we can see in bro, that is barley, rye, oats and wheat. So clients with the celiac disease cannot eat these foods. Here the infant is 3 week only. 3 week old infant will not consume all these items. Okay, the infant will consume only the milk. So this history would not be a factor at this time. So option 2 we can avoid it. In option 3, physiological hyperbilirubinemia occurs due to the newborn's immature liver that is unable to metabolize hemoglobin byproducts. This is normal finding that is unrelated to pyloric stenosis. So we can avoid that option 3. Okay. So in pyloric stenosis, that is hypertrophy of the pyloric sphincter, eventually cause complete obstruction from the stomach to intestinal area. Classic signs include projectile non-virus vomiting, olive-shaped right upper quadrant mass will be there, olive-shaped mass, then weight loss will be there, dehydration and electrolyte imbalance, especially metabolic alkalosis we can find in pyloric stenosis. That's why we have selected the option A, assess the parents' feeding technique. Then option D, check the vomiting is projectile or not. And option E, compare current weight to birth weight. I hope you understood clearly related to pyloric stenosis. What is hypertrophic pyloric stenosis?
Introducing the all-new Nursing Manthra NClex series, which contains question bank, which is including the new generation NClex questions. Rationale followed by each question helps you to understand the question. The explanatory video collections with the help of illustrations and animation. Exam handbook, mock test and cheat sheets. Select your package now and get started. For more information about the subscription plans, you can contact Nursing Manthra WhatsApp.